Hey, Dave with Align Therapy. I wanted to talk about a research article that came out in March of 2024, so kind of recent this year in March. It's titled A Comparison of the Effects of Supervised versus Home Schroth Exercise Programs with Adolescent Idiopathic Scoliosis. The reason this kind of sparked my interest is it's looking at supervised versus home Schroth exercise programs. As we get technology better and more options as far as technology goes, there's more options in doing things at home rather than needing to come into the clinic to do them. I get asked all the time whether we do virtual visits or off-site visits, that aren't in person. And historically, I've not wanted to do virtual visits because I didn't know the effectiveness of that, and I didn't want to water down treatment, or ethically I didn't want to give substandard care just to try and do it virtually. During COVID, we actually tried doing more virtual and at-home care. So it's interesting, in this study they looked at supervised versus home Schroth exercise programs. This wasn't technically telehealth or virtual visits, but they relied more on a home-based program during the course of this study. So it's interesting because we do have patients do a lot of home-based exercise. We usually, at Align Therapy, will usually see them for between 8 and 10 visits to learn the Schroth exercises, and then we will have them go on a 3-month follow-up where for 3 months they'll work on their own, and they'll ask us questions and things like that, but we'll see them 3 months after that. So we are doing similar to this, where we're seeing that home-based exercise. And the study was looking at, is there a difference between supervised exercises and home exercises with the Schroth method? So one thing that was really interesting, I wanted to see how they were actually doing the home versus the supervised. And if we look at let's see if I can get down here, they used topography to actually look at the symmetry of the spine before and after treatment, which was really cool. We're starting to do more with topography as well. They looked at interventions where they started both groups. So they randomized these groups into a home-based and a supervised group, and they started this with a 90-minute session where they trained them in how to do Schroth exercises. So it talks about, they discussed breathing, rotational breathing, they talked about pelvic correction, they talked about elongation, fundamental tension and positioning. And during the same session, the participants were taught shoulder countertraction, muscle cylinder, sideways hangs, prominent hip, and Schroth walking exercises. So it looks like this was in a 90-minute session. That is a ton to go over in a 90-minute session. I don't know exactly how they did that and how they got all of that in, because that is a lot of training. So the supervised Schroth exercise group, they were seen for an hour twice a week in the clinic for 12 weeks. So they did 24 hours of instruction over those 12 weeks. And they went over and went through Schroth exercises, starting from 8 to 10 exercises up to 15 different exercises that they were doing in the 12-week treatment period. The home-based Schroth exercise group, so there were 24 of those. They were asked to do a home exercise program consisting of those exercises that they had learned on that first visit for 1 hour every day for 12 weeks. And so the PT designed a home training program at that initial session and practiced with the patients for approximately 90 minutes. So then they were given 8 to 10 exercises, and then that increased to 15 different exercises during the 12-week treatment period. So they did 5 repeats of each exercise and 2 sets for sessions. So the PT checked the participants' exercises every 4 weeks in the clinic. So they did come into the clinic every 4 weeks, but they weren't being seen quite as supervised. So what was interesting to me is, first of all, that's a ton to train someone in a 90-minute session, in that initial session. And trying to get them to learn those exercises in 90 minutes would be very challenging. We rely a lot on follow-up and tactile cueing, manual cueing to get people to do the right thing with Schroth exercises. But in their conclusion, in their results, they were showing, well, if we go down here, in their results, they were showing improvement in imbalance and the measures that they were looking at in both groups. There wasn't a statistical difference between the two groups. So what that tells me is maybe we can teach these exercises faster. Should we teach these exercises faster in all patients? I don't think that's the case. I think maybe what it is we look at this as individual training. Maybe we can get away with a little less instruction at first with some of our patients, and they can do well at home, and maybe some of them need more specific individualized one-on-one treatment. So that was one of my takeaways. Maybe I can identify patients in the clinic that don't need as much hand-holding. Maybe not everyone doesn't need 12 visits to learn the exercises. Maybe they can learn it faster and move more to a home program. It also makes me think, so in this study, they had them come back every 4 weeks to check in and make sure they were doing things okay. I wonder if we supplement the home program with a telehealth visit or some type of virtual visit to get them some feedback on how well they're doing things, if that would help reduce the need to travel, if that would help reduce the cost, and if that would also help with our outcomes. Historically, in my clinic, we'll see someone for about 10 weeks, about 12 visits to learn the exercises, and then we have them go on a home-based program 3 months, and then we'll see them for a follow-up. During that time, I usually just kind of let them take the reins and they do the exercises and ask me if they have any questions. But it makes me think that maybe I should be following up with them a little more consistently, either through telehealth or through having them just stop in for a quick visit in the clinic to review and learn the exercises. So it got me thinking about how we can use home-based exercise in the treatment program. I don't think that all patients need to be seen in the clinic, twice a week until they're done growing. Definitely don't think that. But there is a benefit to having them in the clinic. So in this study, it's not showing that there's a significant difference between the two. It's interesting to look at the conclusion that they have. It says, in recent decades, knowledge of idiopathic scoliosis and its treatment has grown thanks to broader interest in and better quality of research, which I totally agree with. If three-dimensional scoliosis-specific physiotherapists such as Schroth are unavailable, alternative methods should be investigated today. We recommend that future clinical studies examine the effect of different types of exercise techniques. The literature needs more clinical studies. I think every conclusion comes up with that we need more clinical studies, but it's interesting to see that it says if PTs who are trained in this are unavailable, alternative methods should be investigated. With technology and with the access to technology and the internet, I feel like that is a really good point. That there are a lot of people who don't live close to someone who does Schroth Method exercises or is trained to do that. Sure, you can find things online. You can see stuff that we've done on YouTube with the Schroth Method, but it's not specific to the person. Until we can get that more specific to the person and do remote and virtual care, I think we're going to be lacking in how we can reach those people who truly need it and don't have access to it. So this research article kind of sparked more thought in me about how we can utilize virtual care and home-based care. And I think over the next over the next few years, we'll probably see more research on that. And being able to remotely monitor, which is something I'm really excited about, remotely monitor with topography. So stay tuned for more information on that. And if you're a therapist using Schroth, maybe think about how you can augment or supplement with home-based exercise and follow-up. And if you're a patient, I think with this, it shows that at-home exercise is helpful. And so make sure you're doing your exercises at home. I know that's a struggle for a lot of my patients. So keep at it, keep working at it. Don't forget to subscribe to the channel to hear more information and some cool stuff that's coming out with topography and remote monitoring. And we will check in with you next time. Thanks.